Hello dear student, welcome back to the Pharma Learning channel. Today I brought one of the important video that's for the pharmacy technician students who are studying or they are going to complete the pharmacy technician course in Canada. So this video is represented to the pharmacy technician license exam preparation that is taken by the Pebc. For any tutoring or the coaching need for the license exam preparation related to the pharmacy technician examination that is taken by the Pebc, please feel free to contact me on the pharmalearning@gmail.com at any time. Now let's try to understand what is the basically the PBC is a Pharmacy Examination Board of Canada, which conduct basically the different type of the license exam, that is the license exam for the pharmacist, license exam for the pharmacy technician. So the students who have completed the pharmacy technician course from a recognized college in Canada, after the completion of that course, they will have to appear for this license examination. And once they will have the license for this one, then they can work in the retail or the community pharmacy or in the hospital pharmacy or the industrial pharmacy whenever the position required for the pharmacy technician. Basically, this exam is going to divide into the two parts, part 1, part 2. Part 1 is MCQ based exam will be there, that's multiple choice questions. It's totally computer based nowadays. The time that is allotted for this exam on the previous website is 3 hours 45 minutes, but the actual exam time will be 120 minutes. The part 2 of this pharmacy technician exam will be that's also OSPE, it is taken 1-to-1. Basically the time which is written on the website, that's a 6 hours 30 minutes, but it is divided into the two half, each half of 80 minutes each on the same day, and the actual exam time will be 180 minutes. For both of this part 1 and the part 2, 3 attempts are given for the each of the part. Once you are able to complete the part 1, then and then you can appear for the part 2. So I can say that the 3 attempts are given for the part 1 and the 3 attempts are given for the part 2 separately. But by any chance you are not able to clear at the 3 attempts, then you will request to the PBC, and the PBC will allow the one more attempt, that is on the mercy basis on each of the part. Now let's try to understand. Into this video I try to focus on the part 1, that's MCQ exams only. The MCQ exam is basically having the 90 questions, and this 90 questions, out of this the 80 questions are scored and the 10 questions are unscored. What do I mean the score means? Out of that only the marks of 80 questions has been covered or has been evaluated, while the 10 questions are kept randomly. For that no grade has been evaluated or no grade is to be given for those remaining 20 questions. But you will not able to distinguish between the scored and the unscored questions. So you have to answer all the 90 questions. Yes, here the MCQ, that's multiple choice question, is of the type into which you will have to find out only the one best answer. These 90 questions are divided into the set of 9 questions, that is a set of 9 with each having the 10 questions in the each one, and basically the 13 minutes per set. So 13 minutes per set, that is of total 9 sets, or you can say the 30 minutes allow for 10 questions, so totally 170, so approximately 120 minutes, that is 2 hours is allowed for answering all these questions. The questions can be basically divided by unattempted, attempted, and the flag question. Unattempted means, as usual, you are not answered any of the questions, so it will indicate on your screen which are the unattempted questions out of total. Attempted means the question which has been already answered. But here the one more option is given by the PBC when you are appearing for the computer-based exam, that you can flag the question. What is by the flag question? The flag question means that questions may be answered or unanswered, doesn't matter, but the flag can be done, or the flag can be given by the person who are appearing for the exam, that is examining. And this flag is an option for the journal. It is selected by the person who is appearing for the exam. If the person is having any doubt for the answer, or person wants to check at the end, double check with the whatever the answer or the what the option he or she has selected, the best one. So that is called as a flag one. So the flag one may be either it comes from the attempted or the unattempted. This doesn't matter. Now this part 1, let's try to go understand the details for the part 1 MCQ exam. Yes, the 90 questions come from the 9 different competency of the sections, and these things you already studied throughout your 2 years curriculum in the pharmacy technician course at any of the college. Each section or each competency has a different weightage, and as I told you earlier, that will be the 9 set, and each set will carry 10 questions. into which there's a matter the questions from the any of the section can be formed or the prepared, so that the one section having the 10 questions, it's not like the 10 questions will come from the same competency, it will be the one from the other, one from the each can be also taken place. Yeah, now I will highlight in my remaining of the presentation this competency of the section from the highest to the lowest weighted depending upon the whatever the percentage or the whatever the valuation or the weightage is given in the exam. So I divided into basically into the section A to I. Let's start with the competency A or the section A. Section A, into which the basically the questions or the topics which you have studied under the pharmacy technician course, that is like a product distribution, and out of that 39 questions are going to ask from the 90 questions. So this is the major part. Now, what are the topics which are covered under this product distribution? Under the product distribution, it's basically the things related with the prescription net, right? How we are receiving the prescription, how we are interpreting, and how we are processing the prescription. As a pharmacy technician, when you are working in the retail pharmacy or the hospital pharmacy, you have to perform or dispense some of the products. So you have to go for the dispensing calculation, product preparation, and once the product is ready, you have to pack it and label it into the suitable manner. So that will be there. The question related to those things. The question related to the supply of the sometimes ready-made prescribed product will be there. It may be the generic or the branded, doesn't matter. And the questions will be related with the compounding of the sterile preparation as well compounding of the non-sterile preparations will be there. So I can say that this is the most important part or the competency of your entire pharmacy technician exam. And because almost 39 questions, so you consider like a 40 to 45% of weightage is given on this particular competency or this particular section covering this particular points will be there. Now the next important quiz competency of the section after this one is competency B, that's called as relative to patient care. Yeah, in this the questions will come regarding the details about the different pharmacological category of the drugs, the dosage form and the special packaging requirement, like that let's say the generic and the branded drug name and their indexes will be there. I just given the list of the some of the drug category, like the drugs which are acting on the autonomic nervous system, the drugs which are acting on the GI system like oral hypoglycemic agent, insulin, the drugs which are acting on the respiratory system, like anti-asthmatic the drugs which are acting on the circulatory system, which is used in treatment of higher cholesterol, vasodilator drugs which are acting on the eyes, nose, ear and the throat, drugs acting on the skin, besides an antibiotic, antifungal, antiviral, anti-cancer, anthelmint, anticoagulants, antiplatelets, antihistamine, anti-angina, anti-arrhythmic and the anti-allergic drug will be there. Now, what type of the things you have to prepare from this different, these are the some of the this all the classes or the category of the drugs will be there. So you'll have to just briefly prepare about the mechanism of the each class. Then you know how to have the different subclasses with the examples. Then you'll have more know the most prominent side effect of a particular or the adverse effect of a particular that's a group or the groups of the drugs, and then the therapeutic or the prophylactic use of drug, what the dose, what are the doses form available, what type of the drug interaction, the food interaction will be there, and the special requirement. See, this question is too much lengthy. This section is more lengthy, but the 14 questions are come. So try to go from each of the category of the what are the points I mentioned in the last one. You do not to prepare all the things. You should know the brief about each of the things what I mentioned in the last point. The competency basically brings the communication and the education into out of which you will have the 9 questions. Now here, what is the communication and the education? Because we sometimes relate it when we are have to supply the prescription to the either to the patients or we will communicate to the patient. Then how we are going to go and how to provide the educating to the patient as well as the pharmacy team. The other member like a pharmacy assistant will be there, pharmacist will be there, other healthcare professionals. Sometimes you'll have to contact the medical practitioner in the case of a doubt. And another thing is that you'll have to contact to the public or the people will be there. The another competency D will be there, that's related with the ethics and the regulation. That is 7 questions will come. Basically under the Canada, that's Canada Health Act 1984, which try to explain you the follow the 5 basic principles. Then you find the Controlled Drugs and the Substances Act, that's called as the CDSA, into which you are finding that's 1992 from the schedule 1 to 6 that try to control the narcotics and the other controlled drug substance distribution and handling throughout the Canada. And then you find the ethical code of the principles will be there, which will try to follow again the 4 principles will be there. So questions will come from this particular 3, that is either the direct questions will come or the indirect questions will come, like giving any of the incidents or the any of the event will be there. The competency E, into which intra and interprofessional collaboration will be there. Out of that, 6 questions will come, into which you'll have to create, maintain, and participate. That is with the other members of the healthcare team, like pharmacy assistant, and pharmacy technician is mostly going to be communicated with the pharmacist and sometimes to the medical practitioner. Yes, the pharmacy technician has to accept the referral form and make the referral to the pharmacist whenever it is required. So the question based on this will come. Another competency into which the quality and the safety questions will come, that is from this particular section 6 questions are going to be asked, into which here the pharmacist has to develop, implement, and evaluate the policy, procedure, and the related to regulations to promote the quality and the safety. So this is a very important thing will be there. So 6 questions will be asked from this one. The next competency, the into which 4 questions will come into with the management of the practice setting with the goal of ensuring the effective and the efficient product distributions, that will come on this one. After that, the competency H will come into the knowledge and the research applications, that is related with the 3 questions, into which they will try to find out the how to assess, how to retrieve, how to apply the relevant informations to some of the that's event informed decision within their bad practice. And another thing will come like a competency I, that will last two couple of questions will come from this one, that will try to support the health promotion activities for either the patients, community, populations, and the collaboration with the pharmacist. So I have just tried to into this video I will just divide it. I go to highlight regarding the brief about the how the number of questions going to ask from the which section and how we are going to prepare each of the sections will be there. For more in the detail, if you need any help for more videos, so please if you like my video then give like to my video, and please subscribe to my channel for the more upcoming videos related to this field. That is, subscribe to my channel to the pharma learning channel, and you can reach out me anytime for this pharma technician preparation exam need exam preparation help you need at any time. Thank you.